we keep saying the diagnosis of cancer is not the end, and that there is treatment and there is, a light at the end of the tunnel. But during treatment, during whether it's radiation, chemo, what is the role that nutrition or food for the patient as well as I feel for the caregiver, because there is a lot of conversation around alkaline water or, a particular type of food. Juicing is also something that people talk about. Do you recommend as a doctor any particular diet to follow, both for the patient and the caregiver?
So, cancer itself is a stress on the body system. And cancer is consuming the calories, consuming the body system. And most of the treatments are also a stress, be it chemotherapy, that's a chemical stress, or a radiation. And there is generally a tendency to lose one's appetite during that time. And therefore, there is a shortfall what the body needs and what the patient eats. And that's where there is a critical role of nutrition, And in most of the big cancer centers today, we are backed by nutritionists who understand cancer nutrition as a subject. But as a cancer physician, the overall message to the patients and families is that you need what is cooked in the kitchen. Don't change your diet diametrically. What you're used to for the last so many years. And there is no chamatkari khana. There is no magical diet. It's the kitchen diet, supplemented with a little more protein, because the body needs to build up the tissues which are breaking because of the cancer, because of the treatments. So one needs a little more, and some supplements which are medically directed. We were talking about the supplements for a healthy individual. Now we are talking about supplements to someone who's undergoing treatment. So these are very controlled and very calibrated supplements. And these are not everyday supplements. For example, a lot of our B complex supplements contain folic acid. And we use drugs which are anti-folates. So I don't want to give what is good for A and may not be good for B. So the two prescriptions may be different, depending on the drugs. So normal diet, little extra protein, some supplements, very calibrated what we give. And also the caregivers are indeed going through a stress themselves. Their whole day's routine may be disturbed, their eating patterns would be disturbed, what time they are eating, because they are looking after patients. So they also need to sort of regulate their food habits and their diets. Now, we are bombarded with, a lot of questions that kiwi helps in building the platelets. There is a fruit which I heard, my apologies, for the first time from one of my patients. This is graviola from South America. They said this is a cancer buster. And I was surprised. I said, please give me a day, I need to study. So there will be some, unique products or unique fruits and vegetables coming from different geographies which people are used to eating them in those environments. If you go back to our traditional living and traditional eating, what we used to eat when we were young in our village, it used to be according to the season. My grandmother would say, curd during so-and-so season, and lassi during so-and-so season, and an unseasonal, stay away from it. And that's what we tell. Eat seasonal fruits. Don't eat unseasonal fruits. Brought in from somewhere, your body is not used to. So it's quite a bit of common sense with some supplementation, which the nutritionist would understand, the physician would understand, but there is no magical diet.